gotta take this to the trash. All right. I hurt my back.
And the Oscar goes to...
Let me take you through what I do at home to reduce some of this acute pain in 5 minutes or less so I can get back to work. But first, please spend a few seconds to like our video, subscribe to our channel. If you found this video helpful in any way, please consider hitting the thanks button and donating. Also, our team has worked hard to bring some fun and inspiring merch for a limited time. You can check those out below. We appreciate your support. When my back locks up, there's a few exercises I want to get right into. So we're going to get right into arch and sag. And so what I like to do is you're going to get yourself, here's neutral, on your hands and knees. And really it's just 2 steps. All you have to do is start yourself either in an arch position or a sag position. What we really want to do is, for me, I just want to be in this arch position, and then I'm just going to rock forward and backwards. I'm going to find wherever it is along my spine that it's tight. So right now I'm getting some tightness right around here and in this area. Usually to the outside person, it's a flatter area. So it looks flatter and doesn't look like a nice St. Louis arch type of thing. So right here is about it. Then what I'm gonna do is I'm just gonna shift my weight from left knee, left hand to right knee, right hand. And I'm just gonna go, which way's tighter? And for me, it's actually shifting to the right. So I'm just gonna stay in this arched position and just rock. And this usually is a gentle motion, especially if things are starting to swell up for some of the acute pain, back pain folks that just had their back locked up. You're gonna want to do this for a little bit of time. So pressure on, pressure off, pressure on. You're gonna know when things feel a little bit better, when you can shift more weight or the back starts easing up. Now, usually if you're in a locked position or you've locked out your back, you don't necessarily want to go right into this right away. So this is more of like a chronic thing, but I just want to show you. I wouldn't do this if this has just happened a few minutes ago. You're going to go right here, and once again, I'm just going to go left and right. And for me, going to the right, once again, is tight. So I'm just going to go pressure on, pressure off, pressure on, pressure off, pressure on, pressure off, and now it's getting easier. So that's the first exercise. You can see that for me, it actually took, just a minute, minute and a half. Now we're gonna get into getting some length. So if you've got your disc or or maybe even a small bulging disc that's happening to you, we want to get right into either a ball, or we can link some of the exercises of our lumbar decompression below in the descriptions box, but I've got my handy ball over here. And your general physio ball. Okay, what I want to do here now is I'm going to, just like that last exercise, the arch and sag, I'm going to go right in here and I'm going to hang out right where there is some relief. I'm feeling this expand, everyone, and lengthen. I can breathe right into this ball, and that kind of gives some decompression. Or I can kind of move side to side, just like that last exercise. So you can see it's a little segue. I just got a little pop and click here, which is kind of cool. Not that I was going for that, but that's always nice. Sometimes you might feel like a nerve repositioned itself. And I just go side to side until I feel better. So after I'm done with the decompression, I can move right to my back and actually get into heel digs or hip holds. So we're gonna show that next. I'm gonna put the ball back. All right, so the last exercise, you wanna strengthen those hamstring muscles and get your hips more stable. The key here is finding the right angle. You don't wanna be too tight up here. You don't wanna be too straight. So about 40, 30, 45 degrees, whatever seems to be comfortable for you all. What you wanna do is tighten your butt, give it a good squeeze right here, and then dig down. So it's a heel dig. You can do this and you're gonna shake. If you don't know if you're shaking or not, just hold it for about 45 to 90 seconds. But once the shakiness is done, or if you feel like you need a little bit more oomph to it, we have our hip holds one. We have an official video. We'll link those below as well.
but the most important is just that you're triggering it this way, squeezing your butt and pushing against your own hand, or you can use a towel or yoga belt. So we're gonna hold that and get that strengthened right away. It's shaking for me, which means I probably need to do more of this exercise. We're gonna hold that. And you should do the other side. So you can do the heel dig once again, but the progression after the heel dig, if you can't move it into this angle, that's okay. You just stay down here. Just remember that you wanna be able to get here. We're always trying to fight the compressive loads of gravity, and it's coming down pretty good, right? Usually it's about 200 pounds per half hour. So we wanna get that out of your system. We wanna combat that. So we're done with the 3 exercises. You can see you could do it in about 4 to 5 minutes. And really what we're trying to do is have a mobile spine and a strong hip as a good base. And that's gonna keep our back from being compressed or twisted or locked up. A lot of times it's a little bit of a twist and some load that then sets your body off. That's usually what causes a little rotation and bending. And usually you're not bending from your knees and your hips per se, that you're bending it from your back, and that's what causes these things. So the major action that happens is that bending, twisting with some load is what sets you up for a locked back. So be cautious of this habit and this motion and get that correct and keep everything in front of you.
Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.